Hey everybody, this is Bridget Danner from Women's Wellness Collaborative with a little segment here with Dave Kursunski from headsuphealth.com. Hi Dave.
Hi, Bridget. Happy to be here. Thanks for having me.
Yeah, so you have a new software that I am not getting paid to advertise.
Hmm.
I am just really sharing it because I think it's a cool resource and I think that some people in our community would be interested. So
Yep.
give us a little intro on what this software is and why you invented it.
Yeah, sure. Well, I think like many people, I had typically gone to doctors in the conventional health system. And in my particular case, I just wasn't able to get the outcomes that I wanted. And I started working with a functional medicine doctor. But the challenge I faced was that that functional medicine doctor had no easy way to access my medical history, because he didn't have access to those systems. And I think just within California here, I had accumulated health records in three different medical facilities just because I'd moved a few times and changed jobs and had to change doctors. So what I was doing was manually copying all my labs into a spreadsheet, which, as you know, is just incredibly tedious. But I could share the spreadsheet with Dr. Justin, and he could review my numbers, give me my protocol, and then we'd review it again 3 months later. And that actually got me engaged in the numbers. And it got me looking at these numbers, which helped me start to understand my health a lot more. I had no idea what reverse T3 was, or my cholesterol numbers and the ratios and why the ratios matter. This was all foreign to me, but having this information got me engaged. And so I decided to build a software program that could solve this challenge, which is help people get all their information organized and then share it with whomever they choose to obtain health advice from.
Perfect. Yeah, I love the concept. I know it's a problem for in my clinic and my own health because it's I ordered like so many labs last summer and I have no idea where
Hmm.
they all are. I was just
Yeah.
telling you I'm about to go to a naturopath and I'm like, oh my gosh, I have to gather all these labs. I love your solution. You said you connect to what like 200 plus patient portal type, places where records are stored, plus some fitness apps.
Yep.
Um, Tell us a little more. And yeah, for people listening, you can go to headsuphealth.com. For people watching, Dave can pull up the
Yeah, I'll
software
share
to
my screen
give a
here.
little show and tell.
Yeah, so one of the things that is unique in the healthcare industry right now is that we're actually able to electronically connect to over 2,000 medical facilities. So that means,
2000. Okay.
yeah, you don't have to sit there and key all of your labs in. You can do that if you want to, because a lot of us still have information on paper. But what it means is you can just sign in and search our database of health systems and connect that to your Heads Up account, and then the labs will come out electronically. So that's part one. The second is how can people also integrate the data that they're collecting at home? So as I mentioned to you when we were talking informally, I check my ketones and my blood sugar. I also check weight and body fat. Maybe I'm using my Fitness Pal or to track my macronutrients. So we wanted to integrate all of the clinical data, sorry, the lifestyle data as well. So those connections are also electronic. So can you see my screen, Bridget, by the way?
I can now. Uh huh.
Okay, I'll just sign in. And essentially, the way the software works is you can set up a dashboard for whatever matters to you. And so in my case, on my dashboard is my blood glucose and my ketones. And this can be completely customized depending on individual needs. So, for example, there's a couple people in my family with autoimmune. And
Mm.
for example, on their dashboard, they have things like their white blood cell count or their creatinine levels. So this is a way to completely customize the information that matters to you and set it up in a way that just helps you keep a close eye on the metrics that matter most. So this keeps track of my physical activity. I've got a metric here to keep track of my sleep on a night-by-night basis and my blood sugar readings. So this is just a way to set up a dashboard for the health metrics that matter to you. And then this is the labs part of it, which is what you and I had talked about, Bridget. And this is all of my blood work for the last 10 years. So we have a way to integrate all of your clinical data. Some of this is coming in electronically. Some of it I've entered manually. But for example, I can just click on my total cholesterol graph, and this goes all the way back to 2005 when I lived in a on the other side of the country. So it helps me have all of the data, even if I've only been seeing a doctor for a short period of time. So that gives me a longer history I can look back over. And we have all of the tests here. And one of the things we just built is the ability to customize these ranges. I know the functional ranges are different than the conventional ranges. So in my case, if I'm on a high-fat diet, maybe cholesterol low risk is not 200 for me. Maybe I'm more comfortable with 220. And yourself as a practitioner, I would imagine there's times where you need to define specific ranges for people, depending on their unique needs. And that's an important thing we wanted to bring, especially for those who are getting health advice outside the conventional system. And then there's different ways to enter data manually. So if I just want to enter my blood sugar every morning, I can enter it manually here. And this is where you connect up your medical facilities and your devices here. And then the last part we talked about, and then I can jump out of the demo, is how do you share that information with the people who matter most? And that's a really important part. So as I mentioned to you, my sister is a naturopathic doctor. She's up in Winnipeg, Canada, my hometown. And all I have to do is put her email address in here, and she will then have access to my data. Or if I want to invite my functional medicine doc, then I just put his email address in here, or a family member, for instance. And then if people share their profile with me, for example, I have, as I mentioned, some family with autoimmune, they can share their profile with me. And so that just allows for collaboration. The main goal for this was so you can share your health information with anyone who you want to obtain advice from. So that's really what we set out to do, and it's available now. It's a free service for people to use. And we just put it out there as something we wanted to build, and we're just kind of riding the wave and seeing where it takes us right now.
Yeah, I love it. I'm really excited. I'm going to be trying to load it up this weekend in preparation for my naturopathic visit.
You're going to be a data geek before you know it.
It's a good thing.
Unless you already are. You already are.
I'm not really. I'm just always keep aspiring to be. So because there is a lot you can learn from data. So for those of us, for any of us, I getting lots of labs run, and I'm in lots of other people's portals, but now it's like I can have my own thing to share, which I think it really takes kind of the power back to the patient, which I love.
Yeah, that was a big part of the vision, was just storing all of the information with the patient and then giving them ways to share that out with whomever. So yeah, that's exactly where we're at.
Well, thanks for sharing your info, Dave, and everybody. It's headsuphealth.com, and it's free, and go check it out. Bye, everybody.
Thanks for having me, Bridget.